Today, the question is related to who's a candidate for Botox, who's a candidate for filler, what are the difference between the two? There's a world of difference between the two. Botox, Dysport, Daxify, Xilmin, all of those are what we call neurotoxins, okay? So a neurotoxin is designed to paralyze dynamic muscles of the face for a short duration, 3 to 4 months in time. The way it works is this, and that is a nerve, when stimulated to do its action, whether it's to raise your forehead, to scowl, to smile, to do your neck muscles, etc. The nerve ending releases acetylcholine. The acetylcholine binds to the receptors on the muscle, and then the muscle does its action, which is to contract. These neurotoxins are proteins that, when injected into an area, they go to those acetylcholine receptors, bind to them, and then it takes 3 or 4 months for those to deteriorate and that return of function to be achieved by that muscle. Fillers, by and large, the ones that we think about routinely are hyaluronic acid fillers. So hyaluronic acid is a product that's homogeneous throughout our body, and what they're able to do is produce that in obviously a massive amount, and you inject it. So it's not for dynamic wrinkling, it's more for folds, creases, or to add volume. The two would have no, well, I guess a tiny bit of an overlapping application, but totally different products. One is for static things, i.e., like I said, if a woman had a crease here at the corner of her mouth, you wanted to fill that crease in and to push that back out, or if you wanted to add volume over her cheek to where she looked like she'd had a cheek implant or a higher cheekbone, fillers are your go-to product there. Someone who has animation and wrinkling across their forehead, between their eyes, at the crow's foot area, those are the candidates for the neurotoxins.